everybody who is attending today our webinar, What Research is Needed to Advance Accountability for Health. We really welcome you today to this webinar. That's an interactive session on prioritizing health policy and systems research for the SDG era. This webinar is co-hosted by the Health Systems Governance Collaborative and the Alliance for Health Policy and Systems Research. For the collaborative, this is the third webinar series on governance frameworks and missing links. And we do want to collaborate with partners along our pathway of these webinar series. And today, we would like to partner with the Alliance for Health Policy and System Research, a partnership hosted by WHO that's aim is to promote health systems research in low and middle income countries. So this webinar is the third of a series for us, but I think it's also part of another series for the Alliance on priority setting for health system research in the area in the SDG era. So welcome to this webinar. I'm going to give you some ground rules before we start. Next slide, please. Very simple ground rules. All participants are on mute, so when you would like to speak, please raise your hand virtually, electronically. In this WebEx system, you can just click on the raise hand and we will see it, and we will give you the floor after the presentations. You can also type your questions to the moderators and we will take up that question and bring it. If we can't really hear you, we can bring it to the rest of the audience. Please feel free to tweet throughout the webinar. You have the hashtag HSS, you have the hashtag governance4UHC that you can see on your screens right now, and several Twitter handles. We're going to leave this slide for a few seconds for you to capture the Twitter handle. And I just want to introduce myself. I'm Mariam Bigdeli, and I'm speaking on behalf of the Governance Collaborative. You have all the other Twitter handles there. We will have presentations first by Dena Javadi from the Alliance for Health Policy and Systems Research. This is to present you the call for research of the Alliance for Health Policy and Systems Research. Kerry Scott will give you an overview of priority setting exercises. This priority setting exercise to identify and prioritize research questions, and we're here specifically on social accountability issues. We will then move to hearing from policymakers and reflections on the priority research questions for their contexts. Sarah Brennett from Johns Hopkins will facilitate that, and we will hear from three policymakers who are with us in the room. Sarah will introduce them later on, and then we will open the floor to participants and questions and answers and clarifications, and we hope for a very lively discussion around this critical governance question for the SDGs. And now moving to Dena Javadi from the Alliance for Health Policy and System Research on the introduction for the call for research.
Thank you, Mariam. If you could just go to the next slide, Carrie. So this is just a brief summary of what the two entities involved here are. So the Health Systems Governance Collaborative that Mariam just spoke to came from a need for collective action in the field of governance, and it's a global network of technical experts, agencies, policymakers, and citizen representatives. It's open to all stakeholders seriously interested in advancing health systems governance. And we at the Alliance for Health Policy and Systems Research have the four objectives listed there. We're there to provide a forum for learning and exchange for our health policy and systems research community, support institutional capacity strengthening for conduct and uptake of health policy and systems research, and stimulate the generation of knowledge and innovation to nurture learning and resilience in health systems, and increase the demand and use of said knowledge for strengthening health systems. So if you could just go to the next slide, Carrie. The reason for this call, this is part one of 3 webinars that have been the product of this particular call for research. The Sustainable Development Goals reflect interconnectedness of social, environmental, and biological systems, and health policy and systems research has a lot of strengths in being able to explore these interconnections. So we wanted to find out what the HPSR priorities for achieving the SDGs would be. So we consulted policymakers and other decision makers to help us understand what some of these research questions could be. The aim was to catalyze investment in intersectoral and multidisciplinary research, to facilitate dialogue between policymakers and researchers, and to develop innovative processes to support identification of HPSR priorities. So from this work, 3 themes were identified that I'm sure Carrie will speak to. The first one being social accountability, which is why we're all gathered here today. The next 2 will also be a series of webinars. Following these, we'll also be launching a research call to actually move forward on the priorities that were identified. So if anyone has any thoughts on how to move this forward, the discussion today will be a space to both discuss how the actual priorities were set, as well as the methods that could come about in terms of making sure that the research produced and the knowledge generated is relevant to the policymaker needs. So with that, I'll just pass it on to Carrie, who is going to take us through the social accountability piece.
Dana. So it's my pleasure to speak to everyone about a project that has been going on for over a year now, and that is a collaboration. I'll just put up the next slide, with a number of colleagues, Nasreen Jasani, Mary Q, and Sarah Bennett. And as Dana mentioned, this is one of 3 streams of work. So we focused on, and this webinar today is on social accountability and accountable institutions for health. Other colleagues and team members looked at systems of social protection and multi-sectoral collaboration. So accountability failures in the health sector are well documented and experienced firsthand by millions of people every day. I'm sure as you're listening to this webinar in your office or at your house, you can think of dozens of examples, whether it's from your research, from newspaper articles, or even experienced by you, your friends, and your family. These failures violate patient dignity and rights, and they lead to preventable morbidity and mortality. Interest in good governance and stewardship has grown and was taken up by the WHO in the 2000 World Health Report. Recently, the SDGs enshrined the importance of accountability in Goal 16, which encompasses several targets focused on accountability. So this includes substantially reducing corruption and bribery, inclusive, participatory, and representative decision-making, developing effective, accountable, and transparent institutions, and promoting and enforcing non-discriminatory laws and policies. So these are subsections of Goal 16 in the SDGs. To achieve the SDGs and strengthen health systems accountability, we need to generate and use evidence on how best to approach this complex issue, how to channel limited resources for funding this type of research, and how to structure programs and policies, bolster implementation, and measure change. So to that end, with funding from the Alliance and with my colleagues at Hopkins, we undertook a 4-stage process. And I'll talk more about each of these stages in the coming slides. But as an overview, the first stage involved looking at existing academic work on accountability in health. The second stage involved consultation with policymakers. The third stage consisted of extracting and synthesizing the research questions identified in stage 1 and 2. And finally, in stage 4, the questions were refined and ranked. So from stage 1, this involved a systematic search of the literature, and we looked for reviews on health committees, scorecards, decentralization, and other forms of local health systems governance and accountability. We ultimately found 34 included reviews, and this involved both systematic reviews as well as non-systematic reviews. So people who'd done scoping reviews and narrative reviews, these were all included. But we did limit ourselves to academic work, which is something that is obviously a shortcoming. It'd be great to take into account some of the rich work produced by NGOs and other organizations. And then we extracted data from these reviews on a range of domains, including the areas that the research was undertaken, the theoretical contributions, and evidence of effectiveness across these various interventions. So you may be wondering why we focused on reviews rather than the primary literature. This was largely pragmatic, and it allowed us to rapidly map the large body of literature. And there is a huge growth in the amount of publication on this topic, which is wonderful to see. But it is in the hundreds and hundreds of papers. So we thought to rapidly understand the scope of the field, it made sense to look at reviews. So the next stage was our consultations. We spoke to senior policy makers as well as some senior staff from large multilateral or bilateral organizations and NGOs. The interviews explored health system challenges to meeting the SDGs in each policymaker's context. And we asked them about any policy changes and discussions that were going on in the context of the SDGs and to overcome and address some of the challenges that they identified. We then went through as many of our 3 themes as possible. Not all respondents had time to speak about all 3 themes, but we focused on the challenges that they were facing, so the challenges in accountability, or as we mentioned, there were 2 others, the challenges in multi-sectoral collaboration and the challenges in social protection systems. And then we asked what policies are being considered on these various topics. And finally, we asked them what were the burning needs for research and what are the evidence gaps that are really standing in their way to bringing about effective policy to address these issues. So of the 54 interviews, 47 included discussion on accountability. We also added 2 focus group discussions, one in Jordan and one in Bahrain, because perspectives from the Eastern Mediterranean region were underrepresented in the in-depth interviews. Okay, so the next stage looked at pulling out the research questions from the literature. So every time a review ended in their discussion section, they often would talk about, okay, so we've scoped out the literature on scorecards, or we've looked at the literature on village health committees or decentralization. And they would often have a section where they talked about gaps. And so every time they mentioned a research question that had not been addressed and that they still felt was important, or every time they mentioned gaps, we extracted those questions into a framework. And in cases where they phrased it as a research question, we just pasted it verbatim. In cases where they described a gap, we rephrased it to be a question. Similarly, from the policymaker interviews and the focus groups, we looked at the pressing needs for research that they talked about on accountability. And we framed them as questions in most cases and matched them to the research questions from the reviews, or we added them if they were on new domains and new topics. So we ultimately got 112 questions from the reviews and 70 questions on accountability from the interviews. So we couldn't ask our participants to rank all these questions, and many of them actually were quite similar and overlapped with one another. So the final aspect here was that we grouped and collapsed similar questions into overarching questions until we had a list of 36 questions, which was considered by the software that I'll talk about in the next stage to be an appropriate number of questions that could meaningfully be ranked in terms of priority. So I've pasted here an image from our spreadsheet, and it just shows one example. So it shows in the middle column that we got 3 different questions from various reviews, and then we got 2 questions from policymaker interviews, and all of them fed into one overarching question, which is listed in the leftmost column. So that was the process there. Finally, and this is stage 4, the other one was stage 3. Finally, we migrated these 36 questions. We imported them into a software called CoDigital. CoDigital is an online collaboration platform, and we noticed some of the people participating in the webinar today actually were our experts who came into CoDigital and helped us with this stage. So you'll know more about the process than I will, because you've actually been through it, and we hope you'll speak up during the discussion. Essentially, this CoDigital stage had two phases. The first was refinement. So we invited 47 experts, and 25 of them logged in, and they looked at the 36 questions, and they had the chance to propose edits. And then the edited question would be given to other experts who are logged in, and they would then choose whether they liked the edited version or they liked the original version. And at the end of this process, 81 edits had been proposed and 225 votes had been cast on the edits. We then took a look at the outputs, and the edits that were widely voted for and accepted, we retained. Some of the edits were not that widely supported, and so we dropped them. And we mostly noticed that the edits were small changes. In many cases, people added a lot more examples to flesh out what we were talking about in the question. And you'll see when I show the top questions that there's a lot of examples to kind of help people link it to their area of work or understand what the question is getting at. In phase two, we asked everybody to rank the questions. And so participants, again, we had 25 experts log in. Participants were shown two questions and were asked to vote on which one was the higher priority. So through several rounds of pairwise ranking, the high priority questions were determined. It's worth noting that CoDigital actually is a proprietary algorithm that helps you develop a more efficient way of ranking questions. So what this meant was, at a certain point, the top 20 questions were exposed to more rounds of ranking, and some of the lower ranking questions fell out of the bottom 20 questions fell out of the voting process. So ultimately, we had our 25 experts cast a total of 491 votes. Okay, so now everyone's wondering, what did we find? This is why you've logged the top most pressing questions. So this is a guy giving a drum roll. And I will now go through just the top 10, because we would be here for 2 hours if I went through all 36 and showed how they were ranked, even though there are gems all the way through. All right, so the top question, and as you can see, it got 70%. So this means that 70% of the time that it was put up against one other question, it was selected as the highest priority by the experts. And this concept of what is a priority question, I hope some of the people who took part in this exercise and who are on the webinar today can talk about that. But we asked them to consider issues about meaningful results, feasibility of conducting this kind of work, and a range of considerations to help them decide what is a priority question. All right. So the first question, what political factors mediate the adoption or effectiveness of accountability initiatives? So this is a really broad question, and it's looking at things like the discretionary power of health providers, the politicization of the health system, and other political factors. And it's saying, so what political factors affect specific accountability initiatives like digital technology, health committees, local media, citizen action? The next question asks, what processes and incentives facilitate the acceptability of accountability mechanisms among frontline healthcare workers, healthcare providers? So this is taking into account the fact that healthcare providers at the front line may at times feel resistant to efforts focused around accountability and may feel targeted. So it's looking at what kinds of incentives, financial, non-financial, punitive, trust building, learning loops, peer review, what actually works to make these interventions acceptable to them. The next question asks, what reforms in the governance of national health systems are most likely to enhance provider accountability? So this is looking at big picture changes in the national health system, like large decentralization movements or the introduction of performance-based financing. The fourth, and as you can see, the top four are actually very, very closely ranked. So, 70% down to 68%. They're really all considered of extremely high priority. What mechanisms and contextual or historical factors enable or hinder various actors to interact productively? So this is really looking at things like, religious groups providing health care, the private sector, civil society. What kind of mechanisms and factors actually enable productive interactions for accountability and responsiveness? The fifth is what conditions or factors are necessary to enable accountability initiatives to address issues at the macro, meso, and micro levels. This is really asking people to try to study the multi-level nature of accountability, and they need to kind of understand how it might act at multiple levels of the system, all the way from changes in the political, social, cultural, and economic environment to organizational culture at maybe the clinic, to micro-level changes around individual ethics or rationalization. Next slide. I'll go a little faster for the last 5 here because we want to get to the policymaker reflections. So the sixth question is, what are the impacts of accountability interventions on the health workforce? This is a straightforward impact question. How does it actually change attitudes, behavior, practices, morale, etc. of health workforce stakeholders? The seventh asks, what is the impact or effectiveness of interventions on aspects of governance and health systems performance? So looking again at impact, but this time on these health system outcomes. 8, how can citizen monitoring and evaluation be effectively integrated into health system planning and implementation? That's a fairly straightforward one to read out. It's a little bit complex to imagine doing research on this. The 9th, what tools and design features can enhance the effectiveness of accountability initiatives? So this is really looking at tools themselves, like digital reporting tools, report cards, social audit tools, community reporting tools. And finally, 10th, how do specific contexts influence the potential for success or failure of particular types of accountability initiatives? So again, this is looking at the broad context: political environment, strength of democracy, social cohesion or heterogeneity, level of economic inequality, health system privatization, just as some examples of contextual features that could be studied to look at how they actually influence the potential of these interventions. So I just will give 2 slides for some reflections. I know it's a lot to absorb really quickly. These top 10 questions are quite complex and there's a lot of components to them. So just some general reflections to help people start thinking about them. One thing that really stood out to us was that 7 of the top 10 questions focused on context, process, and implementation factors that mediate or influence the initiatives. So this is questions, I'll just go back so you can see. This is questions 1, 2, 3, 4, 5, and 10 are all kind of in the same group as looking at processes that mediate effectiveness or or influence the interventions. So we felt that this was evidence that the experts who did this exercise, they strongly position accountability improvements as embedded in the broader political and health systems context. 2 of the top 10 focused on measuring outcomes. So this is questions 6 and 7, and it looked at the impact of accountability on the workforce and the impact on a range of governance and system performance outcomes. And finally, 1 focused on technical aspects of interventions that can improve their effectiveness. And this is question 9, looking at design features of these tools that can enhance their effectiveness. So that's kind of our overview. People might be wondering, okay, what kind of questions fell to the bottom of the 36? And so I'll just give you a sense of some of the lowest ranked questions. And so in rank 36, as the lowest priority, was a question on cost effectiveness of different accountability mechanisms. So these experts really felt that was not a priority. In position 35, looked at accountability mechanisms and interventions for conflict-affected areas. Number 34 was researcher accountability to communities and health systems. So that's interesting that that was a low-ranked question, perhaps a sense among researchers that this is important, but not necessarily vital to achieving the SDGs. I don't know. Reflections are welcome. In position 33, circumstances that led to failed accountability interventions. And in position 32, the impact of accountability interventions on health and social outcomes. So keep in mind, we had 2 questions on the impact, but those were on the health workforce and on other health system performance mechanisms or outcomes. But people did not prioritize the impact on health and social outcomes themselves. So the actual sort of morbidity, mortality kind of outcomes was not prioritized. And the last slide looks at sort of comparing the policymaker priorities and the way the rankings came out. So research questions that arose from a higher number of reviews tended to also be ranked higher priority. So some of the co-digital questions, some of the 36 that we exposed to this ranking exercise, were derived from up to 10 questions from reviews. So 10 different reviews had actually mentioned this topic as something that needs more work, and that all led us to synthesize into one co-digital question, and those ones tended to rank really high. However, there was not a strong alignment between questions that policymakers mentioned multiple times and highly ranked research priorities. Similarly, several research questions that arose from a high number of policymaker consultations ranked below the top 10. For instance, policymakers were very interested in evidence that accountability interventions improved health and social outcomes. But as we discussed, this research question was ranked as a low priority. It was number 32 out of 36. So it's worth reflecting on why. Is there some sort of fundamental mismatch in values? Or were the experts prioritizing based on a different principle? Maybe they felt it was too difficult to answer. Or maybe they felt that answering it would not yield useful findings across contexts. So these are all things to discuss. So thank you very, very much. We're right at the half-hour point, and we now have our reflections from our policymakers. So I will turn it over to Sarah and our policymakers who joined us.
Thank you very much, Kerry, and thank you for such a clear presentation of the methods and the approach used. So as Kerry was just saying there, we had really wanted to embark on this exercise in a way that captured policy and decision-maker perspectives around the kind of research that was needed, and that was clearly one element of the design here, to consult with policymakers initially. So having completed this whole process, we wanted to come back to policymaker perspectives and ask a number of policymakers to reflect on the priorities that emerged. I'll introduce our policymaker panel in just a minute, but I wanted to point out that the top 10 research questions that emerged from this process are available to you. If you look at the top of your screen, it says something like 2018-01-31 top 10. If you click on that link there, and then you can see the top 10 questions that came out of the process. Also, once we've had the policymaker panel, I would be happy to go back to Kerry for any questions of clarification that you may have. So please do use the chat box to start noting any questions that you would like to return to Kerry with. So in terms of our panel today, I'm delighted to introduce Dr. Rajani Ved. Rajani is currently the Executive Director of the National Health Systems Resource Center in India. She has an MBBS from Madras University, an MPH from Harvard, and is also a visiting scientist at the Harvard T.H. Chan School of Public Health. And she has about 30 years of experience working on community-based health service delivery and health system strengthening projects. Secondly, on our panel, we have Dr. Andrea Yearwood, who is currently a policy consultant based in Trinidad and Tobago. Andrea was the Senior Health Policy Analyst at the Caribbean Public Health Agency, which is a regional institution serving 24 Caribbean states. And prior to that, she had served for 8 years as the Director of Policy and Planning at the Ministry of Health in Trinidad and Tobago, and was a policy advisor to the Minister of Health and the Permanent Secretary there. We were very much hoping that Dr. Francis Okwuji was also going to join us, but I can't see him online. And I trust that my colleagues in WHO who are managing the technology here would know if he was amongst the participants. But we have noticed that another colleague is online, and that's Dr. Daniel Ogboabor. Daniel is a Nigerian physician and public health specialist, who's also a member of the state parliament in Nigeria. And I don't know, Daniel, if we can give you, it looks like you have mics. It also looks like you're on your cell phone, so I'm not sure whether you'll be able to speak. But if you were willing to just give a couple of minutes of reflection after Rajani and Andrea, and then that would be excellent. So we had asked our panelists just to kick off the conversation by reflecting a little on these 10 research questions that emerged in terms of whether they thought they were the real priorities, and also how they thought this kind of research could really contribute to policy and decision making within their own particular contexts. So Rajani, if I may, can I come to you to actually kick us off?
Yeah, can you hear me, Sarah?
Yes, we can hear you. You're loud and clear.
Okay. So thank you for inviting me to the webinar. I mean, the 10 questions, they're all obviously relevant to the Indian context, not in the same order of priority, I would think, even though they've been ranked this way. In the Indian context, accountability is increasingly becoming a feature, not just of health, but of other social sector programs like poverty alleviation. And it's really much more than rhetorical. It's not just in the policy documents. There are significant budgetary commitments to enabling accountability. So it is an issue that's being taken quite seriously. And certainly for the health sector, the vision was that creating community platforms and embedding them as part of health systems reform programs would be critical to the process of communitization and community strengthening. Now, of course, this particular thing that I'm speaking about is about 12 years old, and I think undertaking research of this kind is really critical at this point because there are so many governance contexts in the country that it's really important to understand how, and as Kerry pointed out, I mean, I think it was right that several of the research questions actually relate to context and how accountability is mediated in different contexts. So in India, I think one would have to look at the context of where decentralization is strong, local government is strong, and a lot of health sector actions take place within the local governments. I think the second issue one should consider, and I don't know if this came up either in the interviews or in the research questions, is the extent of information asymmetry in different parts of the country. And how do you build capacity of communities to make sure citizen voices are heard? I think one of the dangers of building community capacity for accountability is this issue of, if I may put it bluntly, NGOization. So what we are seeing, and this is, I mean, I think this is an area that we need to work on for research, is to understand what is the biomedia between NGOs building accountability and building capacity for accountability within communities, but making sure citizen voices and a broader platform of action is envisaged. What happens when facilitatory actors like NGOs are no longer there? What's the sustainability of that? I think that's an issue that needs researching. Not sure that it came out in these 10 questions, but I think that's important. I'd also like to speak to this question number 10, which is tools and design features. And I know increasingly in this digital world and mHealth scorecards, which used to be manually filled in, people are looking at all kinds of apps. But I think we do need much more research, and I tend to agree that it's the last thing we need to look at in this list of 10, but certainly yes, because is it empowering really to the people who are using it? And I think that's an important question. And one final point would be the issue of power relationships and hierarchies when you're working on accountability with citizens. And I think that's something that groups need to consider, and we need to be doing research on that, is that when there are local service providers that accountability initiatives take on, how willing and ready are people to back up and continue to sustain accountability efforts when there is really no getting away from local service providers who are there for a period of time? So I'll stop there, and maybe we could come back to some of these questions later.
Thank you very much indeed, Rajani. I think you managed to be remarkably insightful in a very short space of time. So just to echo some of the points that you raised concerning the importance of context and understanding how these kind of accountability processes operate in different contexts. The issue of sustainability that you highlighted, from my perspective, is really key. I think we have so many sort of small-scale failed initiatives, and thinking about how we institutionalize these, particularly given the power relations and hierarchies that you touched upon in your closing comments. So thank you very, very much for kicking us off with some of these really big issues that I think form the foundations for any work in this field. Maybe I can go to Andrea next and ask you in a similar fashion to give some perspectives on these questions from your own context.
Thank you very much, Sarah. Thanks, Sarah. Are you hearing me? Yes?
We're hearing you very, very clearly, Andrea. Yes, please go ahead.
Okay, thank you. And let me say congratulations on a very good piece of work, methodologically quite very strong. So thanks for inviting me to reflect on some of the outcome of the deprioritization exercise. In terms of accountability, the entire issue is very relevant, I think, in any context. One must definitely hold to account those who we hand the baton of stewardship to for the health system. We would want them to account. But if I am to reflect on some of the specific questions, for example, question 2 looks at process and incentives. An excellent question, very relevant in my context. I would say, though, in the context of the Caribbean, the English-speaking Caribbean, I see a focus there on frontline providers. From my standpoint, we would want accountability mechanisms to be embraced by all health providers, as well as those responsible for governance and stewardship of the system. Beyond the question of acceptability of these mechanisms, I think we also need to look at the question of sustainability. And let me tell you why I say that. I reflect on some of the mechanisms or the incentives that we used in our context during the 80s and 90s when we had the health sector reform program. So I can think of initiatives such as, let's say, the Patient Charter of Rights and Responsibilities and our client feedback system, as well as service level agreements with our regional health authorities. We have found that as time has gone on, we have not been able to sustain some of these initiatives. So I think in addition to looking at the whole concept of acceptability, we must also consider sustainability. How can we integrate these different initiatives into the health system so that we can have them on a sustainable footing? There's also the question, I would think, of the right mix between positive as well as negative incentives. So in terms of how do we get that mix right between sanctions as well as a positive incentive? On question 3 looks at reform in governance. This is personally my top question, because in my context, I think the entire system in Trinidad and Tobago, and indeed in the English-speaking Caribbean, needs to move towards greater accountability to consumers. Accountability, as I said, must not just be at the level of service delivery, but must also embrace those responsible for governance. So as part of this body of research, I would like to get a good understanding, a good qualitative understanding, I would say, of those responsible for governance, their perception, what's their perception of accountability and how such mechanisms can work. And I think that would assist us in understanding how our governance systems can be reformed. Question 4 looks at factors to enable or hinder the actors to interface in a more productive manner. Again, another very important and very interesting question. The health system is complex. There are a number of actors. We have, for example, a chief medical officer, a minister with varying roles and responsibilities. Again, if I'm to reflect to my own past history as Director of Health Policy and Planning, I would be responsible for the planning function, the policy function, but I must interact with the Chief Medical Officer, who is noted as the vanguard of the health system, the Minister, who has parliamentary responsibility for health. But yet, when we go to the Joint Select Committee of Parliament, the Director of Policy and the Permanent Secretary are held accountable. So indeed, any research that can improve a productive relationship among the different players would be very important. I also think here, in terms of looking at the different actors, we need to also consider the role of non-governmental organizations. We're in the area of sustainable development, that area. We know the role of these entities, and we have to look at the question perhaps of conflict of interest as well, as we see how we can move towards multisectorality in terms of health. Any other? Let me see, question 6. Question 6 is looking at the impact of different interventions. Good question again. I would like to underscore the need, as I said, to consider those responsible for stewardship, not just those responsible for service delivery. If we're in a system that's decentralized and we have, for example, regional health authorities responsible for service delivery, we have to consider accountability of those boards of management as well. Question 7, in terms of the impact on effectiveness of accountability interventions, great question. Let's look carefully at impact by the different type of accountability mechanisms. If we're looking at the political level, at the financial level, or at the performance level, I think a policymaker would want to know the impact of these different types of mechanisms. Question 8, citizen monitoring and evaluation. I found this to be a rather interestingly worded question. In terms of citizen monitoring and evaluation, I was more thinking that perhaps we're looking at engaging citizens in the planning and policy making process. However, I think here we need to remember that planning does not always follow implementation. So one may engage citizens in the planning process, but due to a number of factors, change in administration, change in resource fortunes of the country, we are not able to move towards implementation. And in reflecting, I really wondered whether that in and of itself can pose an accountability challenge. Yes, so I think in looking at research on the question 8, we need to be very careful also about understanding what does not work, because I think this can be a very costly social experiment. If we're engaging citizens in planning and not moving towards implementation, I think it can undermine confidence, public confidence. So we would want to have a good understanding of what does not work. Question 9 looked at in specific context. Good question. That's going to help us with our adoption and adaptation of initiatives. And question 10, tools and design features. I would very much be interested there in the evaluation question, the evaluation with respect to question 10. How do we evaluate implementation of those features? So that's my quick reflection. Sarah, let me hand it back over to you.
Thank you very much, Andrea, for that very systematic consideration of those top 10 questions. And I think there were some similar themes to what Rajani was talking about, in particular the need for thinking about sustainability and institutionalization. But I also note that you were urging us to think about higher up the system, not just focus on frontline health workers. And I think you also gave really important advice about being cautious in this field and being aware of the sort of possible negative effects of some of the interventions that could be experimented with in terms of sort of undermining trust in these kind of engagement processes. So thank you very much. We've heard that Francis is unable to join us due to sort of a travel hitch. But I'm wondering, Daniel, whether you would like to contribute a few reflections upon the priorities that were identified. You're currently on mute. I think you would need. Yes, there you go. Are you able to join us, Daniel?
Yes, I can join from here. And thank
yes,
you
we can hear you well.
Thank you very much for the opportunity to reflect on these questions. The first issue that I would like to comment on is the misalignment of the policymakers' views and the evidence from the questions that come from the reviews. I think that's also an emerging research question. We need to really understand why this misalignment. It appears to me that there is a disconnect between the policymakers and what the context, particularly at the provider levels. So it questions the other link, the other leg of accountability. What is also the relationship, the bureaucratic accountability relationship between policymakers and providers who should respond to the consumers. Now,
Daniel, if you don't mind me just interrupting, you're a little bit quiet. I don't know if there's any way you can speak a little bit louder or turn up the volume. Yeah, that would be good. Thank you.
Okay, fine.
Please go ahead.
Fine. So the main issues that I want to talk about is the political factors in question one. And the one key issue for me will be the legal framework for social accountability. It appears to me that in many low and middle income countries, the legal framework is not there. What is the interaction between policymakers and user representatives? How did they get access to or how do they participate in sector planning? Again, a lot of decentralization has happened in most of sub-Saharan Africa and Nigeria. We can cite the examples of decentralization, the district health system that is implemented in Enugu. But how has this really enhanced provider accountability? So the questions are really germane. And for the fact 70% of these questions are speaking to the context, process, and implementation factors, really highlight the challenges of governance at the level of whether it's the micro level or the meso level or the macro level. I think one of the greatest issue which is captured in the question 2 is the issue of trust building and the power relationships between user representatives and providers on the one hand, and user representatives and policymakers on the other hand. Now, the issues of incentives are also very important from the experiences in Nigeria, where health committee members, for instance, expect to be remunerated, and this is not provided in the operational guidelines for health facility committee membership. Again, how do these process the incentives, whether financial or non-financial, really affect the effectiveness or acceptability of accountability initiatives? And then for the providers, the frontline health workers, what kind of incentive do we want to create for them? How do they really accept to work with the user representatives? In my experience in Nigeria is that there is mutual distrust between frontline health care providers and health facility committee members. And this is actually the scope and the context of these issues needed to be unpacked very well. Now, if you look at the question number 9, it captures my interest a lot because I think that one of the major gaps is about the institutional design features of these accountability mechanisms. And therefore, this is the question that has been raised by here is quite germane. how can, what tools or what design features can enhance the effectiveness of accountability initiatives? Now, there's a whole lot of initiatives, digital reporting tools, report cards, social audit tools, autopsy tools. Most of these tools have not been used in Nigeria. I think what we have been implementing for some time now have been health facility committees, complaint mechanisms, and service or patient charter. Unfortunately, even the experiences of use of patient charter and complaint mechanisms are quite low. So we needed to, the issues about context and prospects and implementation of these accountability initiatives should really, really come to the fore. And the design features will be important in understanding how to take these issues forward. It's also for the important question to questions number 7 and number 6 and number 7 that really talk about the impact of the accountability interventions, particularly on the health workforce. And this is an issue because the attitudes, behavioral practice, morale of health workers relate to and affect how we operationalize the concept of integrated people-centered health services. And therefore, it is an important question in the context of Nigeria. The issues of how monitoring, citizen monitoring and evaluation, and how it could be effectively integrated into the health system planning and implementation is also germane. And I will cite the example of the budgeting process. Yeah. Now, in our experience in Nigeria, and particularly in Enugu State where I work, the citizens through the Health Facility Committee or Alliance for Health Facility Committee Alliance should be members of the health sector planning team. But in truth, in practice, are they members? Are their voice heard? Do they participate in the planning? Do they participate in how much do they influence the budgeting? And do they even have access to financial information to be able to track the budget? These are important questions. And so these priority questions on social accountability really fit into the context of Nigeria. And I think that they are really, really important. I think for now, this will be my contribution.
Thank you very much indeed, Daniel. You did an amazing job in terms of providing such thoughtful and substantive reflections without any prior prep. I guess that's the advantage of coming from a political background and being used to speaking on your feet. So thank you very much for those really interesting comments. I was particularly intrigued by your comment about the need to think more about legal frameworks for social accountability. I think that these research priority setting processes are often driven a lot by who participates in them. And I was just reflecting back on the fact that we may not have had any legal experts in that group that were involved in the ranking or the refining of the questions. And maybe that was an omission on our part. So thank you very much for raising that.